Right now, there's concerns about measles in the Triad after two cases were identified in Randolph and Guilford counties. In Guilford County, an out-of-state traveler stopped at a Wendy's on Martin Luther King Jr. Drive on March 13th between 5 and 10 p.m. And in Randolph County, a separate exposure at the Tot Hill Farm Golf Club Pro Shop in Asheboro on March 12th between 8 a.m. and noon. So what do we need to know about these two different incidents? Today, we're joined by Dr. Meg Alden, a pediatric physician at Novant Health Forsyth Pediatrics at Union Cross in Kernersville. All right, let's first and foremost just kind of do the 101 of measles. What is measles? Why is it considered so contagious?
Measles is a virus that is so contagious because it can exist in a room for up to 2 hours after a patient with active measles has passed through it. And so it can linger in spaces you didn't even think of.
Okay, so it lingers in the air. So I'm thinking about that person in the Wendy's, and I'm thinking about other people who come through in that 2 hours, not even having physical contact with that person.
That's right. That's why there's so much alarm, particularly around measles. It's highly contagious, one of the most contagious viruses out there. And the fact that it not only can pass from person to person very easily, but exist in the room without a host with for 2 hours is really unusual and what makes it so contagious.
And it's not just I touched something that someone touched, it's just in the air.
Correct.
Okay, which makes it even, more dangerous. And when I think about it, because you think, well, if I go in there and I don't touch anything and I use hand sanitizer, I'm fine. But that's not the case with measles because it is airborne too.
And that's what makes it so hard. Families can look around and identify sick patients from time to time. You know, don't sit next to the sniffly, coughing kid in school. But this is just something different, especially for those who are not covered by a vaccine.
Okay, so these particular cases involved adults, but why should parents of young children be paying attention to these cases?
Typically, the first measles vaccine is given at 1 year. And so for children who are under a year of age, they have not been given a vaccine typically. Now, once you get the first dose, which is usually given between 12 and 15 months, 93% of folks are immediately completely covered as far as protection from the virus. When they get a second dose, typically between 4 and 5 years old, that number goes up to 97%. So if you've been vaccinated, you are most likely covered for protection.
Okay,
But
and
if you
so
have a small one who has not had that first dose yet, that's the packet of patients that we really want to make sure we're protecting.
gotcha. Okay, and so let's talk about some of the symptoms, some of the early symptoms of measles, and that way, maybe like you said, you don't sit by certain people that have these certain symptoms. And then when should we seek medical care?
So measles starts like many viruses do with high fever, often 103, 104, 105. Patients really don't feel well. They have a lot of body aches and just feeling really sick. Cough, congestion, and red eyes, which in the medical field we say coryza, which is an old medical term. But those are the things we're looking for. Now, the rash that folks talk about as far as the measles rash doesn't appear for often 3, 4, 5 days after the onset of symptoms. And so the initial symptoms are that high fever along with cough, congestion, and red eyes.
Okay, so you might think you have the flu, and then you develop that rash, which becomes measles.
Exactly. And so a lot of medical offices are beginning to ask specific questions as folks are calling in to make appointments, say about a fever or cough congestion type symptoms. So don't be alarmed if your office is asking extra questions. Everyone is just trying to keep everyone safe.
Okay, we've got about a minute left. What steps can families take to protect themselves and prevent the spread?
At this point, truly the best option is if you have not been vaccinated and are able to be, to seek out vaccination. If you've had conversations with your provider in the past or had hesitations, that's okay. This is a great time to realize that this virus has arrived to our area and is worthwhile having another conversation about protecting yourself or your children. if you have household members who are under 12 months old, you can cocoon, sort of like we did in the early days of COVID, with sort of limiting going out and trying to just protect as much as possible. It's certainly not an outbreak here by any means. We have had the 2 cases in the 2 counties, but it is on our doorstep. And this is definitely a great time to have those conversations about getting a vaccination.
Yeah, thank you for your time and your expertise and in explaining it all, because I had a whole bunch of questions. So thanks for that. If you wanted to maybe send this to someone else, rewatch this interview, it's going to be in the Two Wants to Know section of our website.